A hotline available 24 hours a day, and now it's easier than ever for Metro Detroiters in need to get help during a mental health crisis. Just call or text 3 digits, 988. You'll be connected with a trained counselor in minutes or less. Around 20% of adults and children experience mental illness right here in Michigan. That's according to the nonprofit Mental Health America. Days ago, Governor Whitmer signed off on the state's education budget, which includes $214 per student for mental health and school safety funding. Tonight, 7 Action News reporter Faraz Javed is taking us in depth to introduce us to one family in Metro Detroit who welcomes any help they can get.
Mood swings, and right here, this smashed furniture, at times even becoming extremely violent. That's how Gail's 13-year-old adopted son functions most days. On request, we're concealing the family's identity.
There's not really any warning. It's, from nothing to crisis in a matter of seconds.
Gail's son has been diagnosed with PTSD, ADHD, disruptive mood dysregulation disorder, and autism.
He needs higher level of security when he is inpatient.
Gail says during a violent episode, calling 911 is her only option. And even though the responding officers from Wayne County de-escalate the situation, there is still no resolution.
He would end up back at an ER where he would be left to sit for days or weeks trying to find him a placement in a hospital.
Before the national hotline, most people experiencing a mental health emergency would call 911 or head to the emergency room. A psychiatrist, Dr. Shama Fahim, says in both instances, sufferers end up waiting either for the police to find the right help or for ERs to go through the triage list.
That wait time could mean life or death for someone who's suffering mental health issues.
I agree. When they're trying to access mental health services or resources in crisis, yes, the goal should be 0.
Oakland County Sheriff Michael Bouchard believes the new system will not only ease off the pressure on 911, but also get mental health crisis callers help right away.
People at the 988 have at their fingertips local resources or phone numbers or connections so that they know how and who to connect them to locally.
Available 24/7, the free hotline features a network of more than 200 nationwide call centers. This means if the local center is busy, calls will be rerouted to the nearest state center, ensuring immediate help.
Where do you think people go wrong when it comes to understanding?
The stigma is the biggest contributor to people not understanding and not having that empathy that is really needed when you're talking or addressing mental health crisis.
Dr. Fahim is also excited about the upcoming crisis care center in Detroit, which once complete, the 39-beds facility will operate like an emergency room, but for mental health and substance abuse patients.
Within Wayne County, there are far more mental health crisis visits to the emergency department, so it's not going to meet all of those needs, but this is a good start.
Now, between the National Mental Health Hotline 988 and DWIN's up-and-coming Crisis Care Center, which is set to open in the fall of 2023, patients across Metro Detroit will have more options to choose from when it comes to that much-needed help. Reporting in Detroit, I'm Faraz Javed, 7 Action News.
Again, if you are experiencing a mental health crisis, you can call or text 988 7 days a week, 24 hours a day. Contacting the hotline is free and confidential almost all of the time. We want to note the National Suicide Prevention Lifeline as well. 1-800-273-TALK is still in operation.